learning and being so inquisitive and all the work you do all the time. Which leads me to talk about something we were talking about a bit at the break, but I want to sort of bring it into the room because I think people are really interested, which is self-care and taking care of yourself and being mindful about the stress involved with this work. And somebody was asking me about what I do, what I'm doing right now, and I said I really evaluated a few months ago, back in April, my husband and I went to Palau. And we went on vacation, and we're paddling in Palau and in kayaking out in the middle of nowhere, which is what I found I really need to do to be able to sort of de-stress. I need to get totally away. I cannot have a place where my BlackBerry works because I cannot be trusted with my BlackBerry. And so, you know, we really sort of were at a point in our lives where I was reevaluating what I wanted to do next. And I found that what I really needed, and it's partially working, I try. When people ask, what do you do in your practice? Although I have specialized training in autism, I try to see a mix of kids. I try to make myself be around typically developing kids a fair amount, because otherwise I start to forget what typical development looks like. So I try to make sure I check in and go to places where I can be around typically developing kids. And for me, I felt like I needed to take a break from seeing a lot of the high stress cases, because I was at a place in my own life after being out in practice for over 10 years in dealing with, you know, some very high stressful situations, especially dealing with the foster care system and kids with reactive attachment disorder, where a lot of times there were suicidal attempts, 11 o'clock phone calls, that the stress was really creating a situation in me that I didn't want to be there for a while. I needed a break to get healthier emotionally, and that doesn't mean I wasn't healthy before. It means that I want to be able to be healthy to be able to be there again. And if you're not in your center, and by that I mean if you're not in a good place emotionally, being for these families is very, very difficult. If you're going through, this is true in all psychology, but if you're going through an acute period of stress, it's really hard to be present for people. It's some of the things that I look for when I'm supervising other staff members, and I've run teams now for 10, 15 years. I've been a manager in mental health. You know, one of the things that happens in our field, because you're PhDs, they put you in management positions. More PhDs are going into management positions. So, you know, I was trying to run a staff of 13 people, constantly dealing with all these issues, parents who didn't have money to even pay for gas. And the stress I found, the vicarious stress, what I was taking home, was really starting to have an impact on my social relationships. So I said, you know what, I need a break. And so I'm going to do more of the research that I wanted to do. I developed my screening program online, and I'm super passionate about that. And I'm writing other things to advocate for families, doing a lot of expert witness work where I can work less hours and have a higher impact. Even though some people find that stressful, I actually find that less stressful because it uses both degrees in my life. And I don't have to be a long-term impact. I don't have to be available for long-term care, which for families don't usually have crises between 9 and 5. And so to really be there for families in a way that's helpful to be a partner, I just found for me, I needed to step back. If you have reflective supervision in your area, how many have heard the term reflective supervision before? You have. Can I ask you what you know about it?
I just went to a course on, it was actually for self-care with providers, and I got to talk about that.
Yeah.
And the first time I ever heard it was about a month ago.
So, you know, I may try to start to play with doing a reflective supervision with folks by Skype, because now that I'm endorsed as a mentor, sort of talking about your own emotional health and how it's impacting your work, we don't often bring into the room. And it's really important. I find that, you know, if I've got, I found that when I was in practice, I would do assessment 3 days a week and spend 2 days a week for report writing. And that's the way it broke down. If I started to see more kids per week, given the severity of disorders I was seeing, that my level of patience wasn't where I needed to be and where I was comfortable with. So really asking yourself those questions, understanding the impact of your relationship with a family and your reaction to the family, and reflecting on that and using that as data in the room. Reflective supervision is really great for that, and sort of finding a peer group, a peer supervision group of people who know your issues over time. I've yet to sort of find this in San Diego yet, but one of the things I had New York, because I went to school there, is I had a group of people that for 10 years we kept together in a peer supervision group. It was loosely, and sometimes it was only monthly, sometimes it was more, but they knew my issues. And if you get other people who know your issues and who can help you sort of see that, hey, Bonnie, you know what? You're working too many hours. And I've come to learn in myself something that if I start working too many hours, it's because I don't want to deal with the severity of what I'm seeing. So I'll just work harder because I'm going to try to fix it. You know, so, which is the exact thing you don't want to do, right?